Will in place. I'm taking care of business, and I have on my cell phone, I have ICE, which is what you put in, and then you put in the information about whoever it is you want contacted. So when somebody comes in and they've got a cell phone, we can pick that up. We look through the contact list for ICE, and if we see that, we know that's the person we're supposed to call. So it's those kinds of things that I've really put into place, and it's been the effect here. And boy, I don't ever hesitate to tell the people I love that I love them, because I know how precious life is and how perilous it can be.
Today I'm working in the communications room. This is where we take incoming calls from ambulances, helicopters, outside facilities, and outside doctors calling in, telling patients are coming into us there, so we can enter patients into the system and get them ready to be seen by our ER team.
We are the youngest crew I think if you average together, we're 44. So we're the youngest crew on the street.
Richmond Ambulance covers the entire city. We're not designated to one area or another, so we can be all the way down almost to Chesterfield or all the way out by Enrico.
I'm an EMT basic. More or less, I'm just trained in all basic aspects. I can assist with some drugs and different protocols. This company, I'm not allowed to. Jamie is a paramedic. She's below a nurse. She can give drugs without orders. She can intubate, which means she can stick the tube in your throat, into your trachea. There's some people out there that call 911 because they're homeless, they're addicted to drugs, they're homeless, they don't want to do anything with their lives. Some of these guys down here can honestly work if they wanted to, and some of these people just aren't given opportunities and they're suffering from it. And being in the EMS, some of these guys that I meet just want someone to talk to listen to them, to have a conversation. Some of these people in retirement homes that are old wartime vets, so am I, and I'm only 22. They just want someone to communicate with, and they're sick, and that's all they want. Some people are psychiatric calls. You pick them up because somewhere in their life they broke, or they had some type of mental breakdown where they're not all there anymore, and some of them aren't all bad.
16, 19, 96, hold on just one moment.
One thing she's complaining about is lower abdominal pain and burning sensation down about probably about the lumbar. Yeah, about the lower lumbar. No medical history other than a urinary tract infection, which she said she was taking Percocet for about 2 weeks ago.
Not feeling any pain in your chest? Alright. Deep breath. You ate today, you don't feel sick to your stomach?
I haven't eaten anything. I don't know what to eat.
What are you making me for dinner? See, we were on our way to your house. For dinner.
Y'all got some Campbell soup.
Campbell soup? No loss of consciousness, no head injuries, complaining about lower back pain, increases with palpation. Well, the good news is they'll probably have you off this backboard soon.
Good.
After each call, we clean up, we get ready for the next one, we change sheets, we'll wipe down the cots if necessary. We'll change out things, you'll see us putting things in the monitor. Jamie can drive to some calls if I let her. Usually I don't let her have the key, just for personal references.
No, pull your way a little bit. There we go. You feel hot? Well, I know you are. We're taking MCV, right?
Yeah, MCV emergency room.
Alright. Diabetes and hypertension. She's hypertensive at this time at 230 and 150. Has a pulse rate of 106. She's sat 100% on a couple years of O2. Okay, are you allergic to any medications at all?
Not to my knowing.
Okay.
Like that.
I want you to look at me real quick. I want you to stick your tongue up the top of your mouth, okay, like this. And I'm gonna stick this little pill under it, okay? I don't want you to swallow it. I want you to just let it dissolve under your tongue, okay?
And what that for?
It's to kind of bring your blood pressure down, okay? I'm a little concerned that you're filling up with fluid on me because your blood pressure's so high, okay? No, your bronchitis that you told me about?
Yeah.
That's what that breathing treatment on your face is for, okay? With you coughing up stuff like that. No, still up through the roof. Said it's still through the roof. Your blood pressure.
You know, and it's not about the money. These people that do it every day, the cops, the firefighters, the medics, the money ain't that good. You know, and some people were like, I think we had a lady one night, she was like, oh, I'm sure you guys make good money. That's the reason you put up with it. No, we don't. You know, there are people that work at McDonald's that make 2 times more than I make. So,
Probably not gonna let you shoot here. So you know, okay?
they knew that she was going to have it, and it's better to, I guess, transport and deliver in the ambulance than where somewhere they didn't have anything, you know. Obviously a hospital is the better place to have anything because they can stabilize and then send out, but they just wanted somewhere where there's a pediatric doctor in case there were any problems. So. Rock and roll, you ready?
Drive fast!
Last BP was 129.69.
Drive fast, I got it!
You see, I mean, you can see it, you can talk about it all the time, you can see it all the time.
See it.
Yeah, or when you do it, you know. Her, especially in her case, she was by herself, she didn't have any family. You know, just being nice to somebody like that you know is in a rough situation is gonna go a long way.
MCV Triage Wanda, I have an LMD patient for you from community. I'm sure the MDV's already given report before, but I would call and check. They're about 5 minutes away. Emergent? That's what I heard last.
Okay, well, what kind is that?
Oh, what is that? That's your water breaking, sweetie.
Oh, God!
Hey, we got broken water! Go! I don't have sterile gloves on, sweetie. We're not ready. RJ, stop! Get your ass back here now! All right.
I wasn't
Go. Go. Push. I need that open.
What's this?
I need the bulb syringe. Open bulb syringe.
Push.
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 Bulb syringe. Open.
Push.
Push.
Ooh.
All right.
Baby, baby!
And mouth. Mouth. Okay, nose. Nose. There we go. Come on, baby.
Come on, baby, baby. Come on.
Come on. There we go. Mouth. New mouth. Come on. All right. Mommy, I need you to hold baby.
There you
Hold
go.
baby.
Wrap her up.
Yeah, we're going to do that. Hold her. She's
Wrap
right
her.
here.
Wrap her.
I'm working on it.
Wrap.
Usually babies would cry. She didn't cry, but she was blinking. And she started to pink up real good. Most babies, if they're not going to do anything, they're going to stay blue. She pinked up when she come out. When we sat her in her mom's arms, she started to pink and she started to blink. Some babies are different. Come on, baby. Come on, baby. Come on, baby. Come on, baby. Come on,
Suction.
baby.
Suction.
There she goes.
some-
You saw us flicking her foot, trying to rub her foot. She started to blink even more. And you heard her cry that one time, and she just didn't want to cry. I'm sure she's in there crying right now, but it's one of those things. And she was even there, and that was her 3rd kid, and she was still like that. So she was still a little, going through that by yourself, I'm sure is rough. It's just, you don't know what to expect. You know, I'm sure when she told Jamie, hey, it's coming, I'm sure Jamie would, but when you get in the back into something like that, you have a job to do. You know what you have to do. You don't really get to